Okay, let me know when you're ready.
Go ahead.
Okay, good morning, everybody, and welcome to our updates in pediatrics. Today we have Aneesh Hehr, who is a fourth-year medical student at Wayne State University School of Medicine that has done quite a bit of research on sleep and meditation in children. He had his undergraduate degree in biology at Wayne State University, and we are very happy to have him as one of our medical students. So without any further ado, Mr. Hehr, the floor is yours.
All right. Good morning, everyone. Thank you for the introduction. Thank you to everyone for being here today. I'll go ahead and start sharing my slides. Okay. Are you guys able to see my slides?
Yes. Thank you.
Yes.
Yeah.
Perfect. All right. So as mentioned, I'm just going to be going over some research on meditation, its role in pediatric health. I'll be including some findings from our lab. So we're part of the Think Lab, the Trauma History Investigation Neurodevelopment in Kids, which is a mouthful. So we call ourselves Think Lab. And I've also included the link to our website. I've also included my email in case there are any questions that we're unable to get to during this presentation. And before we get into the literature and the bulk of the presentation, I'd just like for you to think about two questions. One, if you've had any personal experience with meditation or mindfulness-based practices. And then secondly, if you've seen any clinical use of these practices, feel free to reflect on it to yourself, but if you feel comfortable, would also love to hear it in the chat. But we'll go ahead and get started. So, over the course of the next 45-ish minutes, we'll cover three main things. First, I just want to go over updated literature on the benefits of meditation in children. So going over why we target these interventions during this age range, different examples of these interventions, health benefits that we've seen. And then secondly, I'll be going over our current understanding of the mechanisms that may explain the health benefits that we see related to meditation, and also how this relates to emotion regulation. I tried to limit the wordiness on these slides so that even if you completely zone out, you'll be able to enjoy some colorful pictures of the brain. And then lastly, I'll be going over just some next steps, future avenues, some cool research that's up and coming. All right, so what are the benefits of meditation in children? So starting off, the question, why have we been seeing more interventions that focus on a pediatric population? When I thought of meditation, I typically think of an older adult trying to, get a break from daily life stressors, balancing home, family, kids. But it turns out that early interventions, including meditation-based practices, they do have a promising role in childhood, in adolescence, and also the transition period between adolescence and adulthood. And the reason for that is that this tends to be a time during development where we'll see the prodrome or the symptoms of mental disorders before they fully manifest. And so this meta-analysis by Dr. Salmi and colleagues, they looked into the worldwide median age onset of several mental disorders. And as you can see, many of them develop during childhood and adolescence. So they found for any mental disorder that the global median age of onset was 15.5. And they found that in about 1/3 of individuals, they occurred before the age of 14, and about half of individuals, the onset was before the age of 18. And so when they broke it down further, they found that the median age of onset for several disorders were 12, 17, 18, and 19 years for neurodevelopmental, anxiety, eating disorders, and OCD. So if we can intervene at the prodromal stage, hopefully we can prevent the development of these disorders, or at least reduce the morbidity that's attached to them. And then the next slide here looks into the peak age of onset of mental disorders worldwide. So the graph on the left showed the distribution for any mental disorder, which was 14.5. The one on the right is more specific for anxiety and fear-related disorders, which makes sense when we consider the incidence of adverse childhood experiences or trauma. And again, these findings are important for researchers, they're important for clinicians because they highlight the importance of early interventions. And as I'm sure I'm preaching to the choir here, but one of the 5 most common ailments that lead to morbidity, mortality, and dysfunctions are mental disorders in youth. And then, unfortunately, the events over the past few years have not helped. There was a brief report from the World Health Organization, and they looked at the impact of COVID-19 on mental health, and we see some alarming things. There was a 27% increase in major depressive disorder, 25% increase in cases of anxiety disorders. And the other concerning finding was that some of these things were specific to a younger population. So, the main point here is that overall there was an increase in mental health disorders in the general population. But one of the reported risk factors was actually a younger age. And what they also found was that there was a higher risk of suicidal behavior among young people. Other risk factors were loneliness, or being positive for COVID-19. And then the other thing I wanted to mention from this report was in individuals who have pre-existing mental disorders, illness severity and mortality from COVID actually increased if you were in a younger age bracket. And so despite the worsening mental health disparities that we see, access to outpatient mental health services haven't been able to keep up. They've been disrupted since COVID. And some of these were mitigated by online services, but definitely not enough to offset this alarming trend. So I hope that background helps highlight why it's important to develop effective early interventions. I'll be going into the role of meditation-based practices, but I just want to briefly define what I mean by those terms. So one of the challenges in this area of research is that sometimes there's a lack of a clear operational definition, and that can limit our ability to examine the impact. So for this presentation, I'm defining meditation as widespread practices that involve monitoring and regulation of attention, as well as an individual's emotion. And there's different ways to achieve this goal. The typical kind of thing that we think about is focused attention. So focusing on your breathing, or like any specific object moment to moment. But there's other ways to reach this goal of regulating attention and regulating emotion. Another common practice that we see is open monitoring. So this is when an individual will monitor stimuli either internally or externally, and not really give it a primary focus. So, the short-term goal with meditation is to improve, or is to, relax oneself. Long-term goal is to improve an overall sense of well-being. And another term I might use interchangeably is mindfulness. So this is like a key aspect of meditation. This is when you accept thoughts, emotions, external stimuli with the goal of being fully present. And I mentioned, like, I'll probably use these words interchangeably for the purposes of this presentation, because mindfulness is a significant component of various types of meditation, and meditation can be used to reach a state of mindfulness. And then I just wanted to list out some other mind-body interventions that you may be familiar with. And it's important to note that these things are not individual distinct practices. You'll see elements of breathing exercises in yoga, in martial arts. For some people, using artistic expression is the way that they be fully present in the moment. For others, they're able to achieve that through exercise. And although meditation and mindfulness-based practices have been studied more and more over the past few years, I haven't seen any compelling evidence that one of these mind-body interventions are significantly more effective than the other, at least that I've read so far. So I think that's something to keep in mind going forward. And then this paper by Dr. Grasser, Dr. Marusak, they provide a framework to kind of define these mind-body therapies along something called an expressive therapy continuum. The big thing that I guess you should take away from this is that this continuum is used a lot in art therapy, where they'll take an artwork that an individual produces and see where it falls on this level of functioning. And it's in this paper, what they do is they list the potential mechanisms along this continuum that may explain the benefit of these different mind-body interventions. So they propose that mind-body therapies can encompass several of these experiences to promote improvements in mental and physical health. And alternatively, another interpretation is that some of these therapeutic modalities start at one end, so the kinesthetic or sensory, and then progress to the cognitive or symbolic end. And so, the focus of this talk is meditation and mindfulness-based interventions. I think this is an important framework to keep in mind. So briefly, I'll talk about the benefits we see in adults and kind of how that compares to what we'll see in children. So there was a meta-analysis by Dr. Goyle and colleagues. They looked at the efficacy of meditation programs in improving several stress-related outcomes. The ones that they looked at were anxiety, depression, stress, distress, mental health, related quality of life. And they did that in adult clinical populations. They looked at 47 trials, about 3,500 participants, and they actually found a significant moderate improvement of anxiety, depression, which was seen at 8 weeks, but also sustained at the 3-month and the 6-month mark. They also found a significant reduction in pain. And although there was evidence of significant evidence of reduction in stress and distress and mental health quality of life, these findings had lower effect sizes compared to the previous ones. In adults, similar benefits have been seen in non-clinical populations, as well as adult populations with more chronic conditions. As an example, there was a meta-analysis by Dr. Zunlin. They looked at 29 studies, about 3,400 participants, and they found in participants, with cancer or survivors. And what they found were significantly lower anxiety, depression, fatigue, as well as improvement in subjective quality of life. And then, another interesting findings is that these interventions, they were effective regardless of the type of cancer that the individual had. So how does that compare to, what we see in children? There was a meta-analysis by Dr. Dunning and colleagues. What they did is they looked at the effects of mindfulness-based interventions on cognition, as well as mental health in children and adolescents. They took 33 studies, about 3,600 participants, and in the randomized control trials that they included, relative to controls, they showed a significant effect in improving mindfulness, executive functioning, attention, depression, anxiety, and reducing negative behaviors. But I think, the important thing to note from this study is that when they only considered randomized control trials with active controls, they still saw benefits in depression, anxiety, and mindfulness, but not so much in the other domains like attention, executive functioning. And the other takeaway from this study was that these effects were in both clinical and non-clinical samples in these randomized control trials. So, given the potential impact of these interventions in improving mental well-being, along with the accessibility and the cost-effective nature of these interventions, there are many programs which have been introduced in the school setting, especially over this past decade. There's this paper by Dr. Semple and colleagues. They do a really good job at evaluating various school-based programs. Some of the things that they look at were feasibility, efficacy, strengths, limitations, and I listed some of these programs on the slide, things like Mindful Schools, Inner Explorer, Resilient Kids, Holistic Life Foundation, and there's several other that are listed in this paper if you're interested. But the big thing to take away from this paper is that there is quite a bit of variety and diversity with these different training programs. Some of the programs include like discrete training classes. Other programs have a school-wide approach. The lengths of the programs vary, so some of them will be a few weeks, some of them will be several years. Some programs require a facilitator at all times, some don't. Some are in person, some are online. And so the upside of this is it allows for a lot of flexibility. You can find a program that suits the school's environment and the resources that are available. But on the other hand, this variability makes it difficult to assess the true effectiveness of these programs in meta-analyses. And so they show a need for more rigorous analysis of effectiveness pre and post-intervention for these individual programs. And as I'll explain in a bit, that's what we tried to do with one specific program that our lab has had the opportunity to partner with. And they're Kids Kicking Cancer. So Kids Kicking Cancer is a nonprofit organization. They provide martial arts-based meditation therapy, which centers around mindfulness-based practices. They offer a pediatric healing program, so in which they teach therapeutic techniques to manage pain, distress in children with chronic health conditions. And although the name is Kids Kicking Cancer, they involve kids with a variety of chronic conditions. So cancer, obviously, sickle cell disease, hemophilia, heart disease, chronic GI conditions. And the goal here is to restore a sense of autonomy, especially during a transitional time where children experience chronic stress. They feel a lack of control due to the numerous external factors, and whether it be constantly going in for chemotherapy, radiation, for various surgeries, transfusions, just even repeatedly being poked by needles. And so this program has branched out to a school program in which classes are offered to children in a school setting. And the idea behind this is that there's unfortunately high incidence of traumatic experiences that a child may experience in their life. And so the goal here is to mitigate the effects of that stress, the stress that can place on a child, and help children be successful both in and outside of a classroom setting. And then I want to briefly show a video of Kids Kicking Cancer, just to get an idea of what one of these interventions can look like. So we'll watch like the first 2 minutes of the video.
Feel the coolness of the air as you breathe in and the warmth as you breathe out. You could just let it fall through the floor because you're a powerful martial artist. It was at Camp Simcha that I came across the reality that I now lecture about in the medical world. I came upon this 5-year-old child in the infirmary in camp who was having his port access for his chemotherapy. 2 nurses are pinning him down. A 3rd nurse has a large syringe to plunge into his chest. I just said to the nurses, give me 5 minutes for this child. And I said to him, I'm a black belt, which doesn't mean much, but to a little kid, it's a wow. I said, do you want me to teach you some karate? He almost jumped off the table. I explained to him, in the martial arts, you learn that pain is a message you don't have to listen to. You could breathe in this amazing chi, this energy, and push out the pain. Watch me. 20 minutes later, they pulled out the needle, and he looked up at the nurse and he said, did you do it yet? And that's when Kids Kicking Cancer was born.
If you have a drug that works on 30% of the population, you have a hit. If you have a drug that works on 40% of the population, you're a superstar. 85% of the kids had a reduction in pain, of which the general across the board average of pain reduction is 40%. That's the remarkability of Kids Kicking Cancer. My mom got a phone call from one of the social workers, said, hey, there's this guy that wants to start a karate class for kids that have cancer. You think Michael would be interested? I'm thinking about getting my daughter well. I'm not thinking about no program.
The martial arts is the care. But the key is giving the kids that internal strength for them to know that they can fight anything that comes their way. Not a physical opponent, but just the things that's going on within their body. And then the exterior things too, like frustration, anger.
It's so empowering.
So if we have time at the end of the presentation, we can finish that video, but I think that gives a decent idea of what one of these programs can look like. All right. And then one of the programs in Kids Kicking Cancer is the Hero Circle. So this is where students in elementary schools, they're taught visualization and relaxation techniques in addition to something they call the breath break, which is a breathing exercise that allows children to, with the goal of helping them control their pain and anxiety. So in this pilot study, Dr. Marisak and colleagues, they took 292 students, 17 teachers, and it was across 3 elementary schools in the Detroit area. The first school was a public school. School 2 was a demographically matched public school, and school 3 was a private school. And they had schools 1 and 3, so the public school and the private school, participate in the Hero Circle program, whereas school 2 was the control school. They completed baseline surveys in 2019. They had follow-up surveys in May 2020. So that was 2 months into COVID. And then they had follow-up surveys again in August 2020. So that was 5 months into the COVID-related shutdowns. They had teachers participate in a 2-hour training program. The program itself was taught for 15 minutes each school day. And this was with teachers and instructors from Kids Kicking Cancer. And it was originally planned for about 26 weeks, but stopped at 19 weeks because of the COVID-related shutdowns. And the first finding here was that there was a high degree of satisfaction with the program. 100% of children and 83% of teachers stated that they would recommend this program to another child or teacher. And then 85% still use the techniques taught at the program at the 2-month mark, and 77% continue to use these techniques at the 5-month mark. And this study also suggested that there's benefits in other domains. Children who continued to use the Hero Circle techniques had lower internalizing symptoms. So this included depression, withdrawal, anxiety, loneliness. They had a decrease in perceived stress over time. And when you compare that to the control group, they didn't show that significant change. Children in the intervention program, the Hero Circle program, they had the ones that reported greater increases in mindfulness, they had greater decreases in problem behaviors throughout the year, in COVID-related fears. And the other takeaway from the study was that these effects were sustained at the 5-month mark after the initial intervention. So that's one example of how we try to take more of like a rigorous approach to pre-post intervention in evaluating one of these programs. And then this slide outlines the potential benefits of these programs, why they're being considered in schools and sometimes in healthcare settings. As mentioned, they can be early and preventative, which is particularly relevant for conditions with an earlier median age of onset. There's little to no side effects. As a medical student, I constantly hear risk-benefit discussions before initiating any therapy. And especially when you're considering medication-based therapy, using these interventions, you always have to consider things like interactive effects, drug-drug interactions, and this isn't something that you don't have to consider with these type of interventions. There's a lower cost to accessing these meditation-based intervention. There's the potential for reducing healthcare usage, especially in cases related to pain or distress, which is an often overlooked aspect, especially in kids with chronic conditions, as well as the family of kids experiencing chronic conditions. So the goal is that if you can improve the day-to-day experience of a child, especially if they have a condition in which they're constantly under stress or constantly being poked, hopefully this can improve adherence to life-saving procedures. And then, in the video you heard one of the researchers, Dr. Bluth, talk about the reduction in pain that they saw with one of these programs. So they looked at the martial arts-based meditation intervention from Kids Kicking Cancer. They had 64 children with malignancy, and they completed a 1-hour session consisting of several things, but one of which was like a body scan in which they focus on the sensation of their breath, as well as a breath break, in which, I talked about that earlier, but that's 3 cycles of breathing in for 3 seconds, and then holding your breath for 3 seconds and exhaling for 3 seconds. And the remaining time, there were several small group and individual sessions focused on martial arts movements. So they focused on participants who had at least a pain score of 1, and this was like a 1 to 10 scale, 10 being the worst. And they found 85% of children had a pain reduction of at least 1 unit of pain. 6.9 reported an increase, 7.8 reported the same level of pain. And it's important to note here that major pain reduction was observed when the baseline pre-intervention pain was higher, so greater than 3. And there were better reductions in pain with increased age. And then there was a subsequent study using the same intervention from Kids Kicking Cancer. This study examined the effects of a meditation-based intervention on emotion-related distress. The key differences here is that this time they included a wider range of chronic conditions, so things like cancer, sickle cell disease, hemophilia, diabetes, asthma. And the other interesting thing about the study is that they included healthy siblings of children with chronic conditions. And there's literature to support that they are at a higher risk of experiencing pain and distress themselves, even though they themselves don't have a chronic condition. So they included 59 children, 19 patients with cancer, 17 with non-cancer but chronic conditions, and then 23 healthy siblings. And so the big takeaways here is that there was a 50 and 89% reduction in pain and emotional distress. And from this figure, participants with cancer reported, 80% of participants with cancer reported a reduction in emotional distress. And in non-cancer patients with chronic conditions, 86% reported a reduction in distress. And in healthy siblings, 100% reported that reduction. And although the change in pain or distress scores didn't differ significantly amongst the different subgroups, when they combined the cancer and non-cancer patients, there was a significant reduction in pain compared to healthy siblings. And I think the other takeaway from this study is that there was a significant reduction in emotional distress in healthy siblings. And again, that's something that can be overlooked in chronic conditions. There's literature to support that childhood cancer siblings, they have a lower quality of life, higher rates of internalizing symptoms when you compare them to non-sibling controls. And there may be a role for meditation-based interventions in reducing the effect of adverse childhood experiences. So things like exposure to various abuse, violence, mental illness in the family, exposure to incarceration, to substance abuse. And so this figure it's by Dr. Ortiz, and they do a good job at showing how in addition to psychological stress, toxic stress can increase, the physiological burden that it places on the body. And you can see this in numerous ways. You can see this in changes at the level of the brain. You can see this in the levels of inflammation, the dysfunction of the hypothalamus and the pituitary axis. You can see, metabolic abnormalities. And then what I found pretty scary about this is the potential epigenetic modifications that could carry into future generations. And so early life stress, the big takeaway here is that early life stress is associated with poor mental and physical health outcomes, even into adulthood. And so this framework kind of helps us understand what the potential role of mindfulness or meditation-based interventions in mitigating these effects. So they've been shown to reduce the psychological, behavioral, and physiological changes associated with adverse childhood experiences. And so this specifically, it reduces symptoms of depression, symptoms of post-traumatic stress disorder, and it's been inversely correlated with poor health behaviors, as well as various markers of metabolic and inflammatory dysfunction. And then, as we talked about in the previous slide, stress has an epigenetic effect. So that could be another physiological mechanism in which you can see the benefits of mindfulness. And that's something, it gets kind of basic sciencey and is outside the scope of this talk, but I always like to bring this up, and it's something to think about. And if you're interested, I can provide this paper to you after the presentation. And then next, we're looking into meditation, neural mechanisms that may underlie the benefits of meditation in children, and as well as emotion regulation. So this is a good time to go over like a brief primer on functional magnetic resonance imaging. This could be a several-hour talk itself, so I'll do my best to keep it brief. And I am not an expert by any means. I have to relearn this before every presentation. But the studies on the next few slides include fMRI. So I think it might be worthwhile to go over. So very briefly, signaling in the brain, it requires energy, the currency of energy being ATP. As we've learned and forgotten dozens of times, we get ATP through oxidative phosphorylation, Krebs cycle. So the more I use a part of my brain, so for example, if I'm like tapping my finger repeatedly, that's the more energy requirement in that portion of the motor cortex. So as a response, you get vasodilation, because that area of the brain, you're releasing several factors, one of them being CO2. You have vasodilation that's going to replenish the oxygen in that area. And so parts of the brain that are more active are going to have a higher proportion of oxygenated hemoglobin when you compare it to deoxygenated hemoglobin. So then that's where MRI comes in, or fMRI. You pass a magnetic field, you are able to construct an image because the oxygenated hemoglobin and deoxygenated hemoglobin react differently to a magnetic pulse. So totally fine if you ignored everything I said in the past minute or two. The big takeaway here is that fMRI helps capture which areas of the brain are active. And then what are core brain networks? So these are referred to as core brain networks or large-scale brain networks. They're distinct regions that are functionally connected, which means that we've noticed a pattern in areas of the brain that light up together or join together to perform various cognitive functions. Or we've noticed them when an individual's at rest. And so those are networks that we'll call resting state networks. There have been several networks that have been identified through fMRI and other imaging techniques. I've outlined a couple of them on the slides. So this includes like default mode, salience, central executive network, and several others. And for our purposes, it's not as important to remember all the names of the different networks or the brain regions that comprise of these different networks. It's just that I know that when I was going through my undergraduate, when I was going through schooling in my undergraduate years, I always had this misconception that one part of the brain does one thing and that's all it's responsible for. I know that might be the case for some things, but that's more rare, and more likely it's like different parts of the brain that are working together. And I just wanted to introduce the idea that some of these brain areas, some of these brain networks have been associated with mindfulness and meditation-based practices, and that might provide insight into why we're seeing the benefits of these interventions. That might be an underlying mechanism. One of these areas is the default mode network. So as you're zoning out during this presentation, this is the brain network that is active when you're not really focused on the outside world. Instead, you're focused on daydreaming or mind wandering. And it's also been associated with depressive ruminating. So individuals, several studies that show that individuals with depression are not good at downregulating their default mode network. You have the central executive and the central executive network. This one is active when you have like goal-directed behavior or when you're focusing on external stimuli. So when you are paying attention to a presentation. And the default mode and central executive is a very gross simplification, but they can be seen as like negatively correlated or anti-correlated. And whenever you have a disruption of this negative correlation, that's something that a common pattern that you'll see in various psychopathology. And then you have the salience network, which integrates relevant emotional stimuli from our environment and helps facilitate the switch from default mode, so like a more of an internal type thing, to a central executive, so focusing more on the external environment. So, the big thing I'd like you to take away here is that you can get the sense that we don't just spend time in like one kind of brain network and then switch to another. It's a bit more fluid than that. And so that's something that in this paper, Dr. Marosek and colleagues explored. They took a sample of 42 children, adolescents. They had them fill out a questionnaire that looked at trait mindfulness, so inherent levels of mindfulness. And then they had these individuals scanned using fMRI. It's important to note that this was at rest. This wasn't when they were performing a certain task. And they found significant associations between trait mindfulness and network interactions, such that children who are more mindful happen to transition more between these different brain networks over time. So they spent less time in one core network and were able to have more of a flexibility. And so when they looked at a mediation model, they found that the link between higher mindfulness and lower anxiety that we've previously talked about was actually mediated by that flexibility to switch between different core networks in the brain. And then this would be a good time to bring up that the neural mechanisms of meditation are distinct from other forms of emotion regulation. So in this paper, they looked at a widely used emotion regulation technique called reappraisal. So reappraisal is when you reframe the meaning of a situation to alter its emotional impact. And they found that during reappraisal, it's actually the prefrontal cortex, or areas of the prefrontal cortex, will diminish the main fear center of the brain. So I'm sure many of you are familiar with the amygdala. And so that's something that is referred to as top-down regulation. So the prefrontal is exerting control over the amygdala, telling it, hey, chill out, we don't need to be afraid right now. In contrast, in contrast to something like reappraisal, meditation appears to exert its effects through downregulating the default mode network, which I previously talked about was involved in depressive ruminating and self-reference, thinking about oneself. And so why this is relevant for children, well, children might not be able to take advantage of the benefits of more like complex emotion regulation strategies because of underdevelopment of their prefrontal cortex. So one example is this study where they looked at developmental changes and functional connectivity. They took 7 to 9-year-olds and compared them to 19 to 22-year-olds, and they found that children had weaker connectivity between the amygdala and several other emotion regulation centers in the brain. And so key point here is that there may be a need for emotion regulation strategies that don't rely on this top-down control, because that pathway may not be fully developed in children. And that leads to the next study, Dr. Bauer. So in this one, they took 99 sixth graders, they assigned them to either a school-based mindfulness training program or an active control group. They used a face matching task during fMRI in which they saw fearful, happy, neutral faces. And then they completed a 8-week mindfulness course. And they found that before the intervention, greater stress correlated with increased activation of the amygdala for when they saw fearful faces. That's something that we've seen in adults before. And then for school-based, for those that were in the school-based mindful intervention relative to the control condition, they felt less stress in daily life. And they also saw changes at the level of brain, which are outlined on the slide, such that kids in the mindful group had reduced activation of their amygdala when they saw these scary faces. And then there was a follow-up study by Dr. Bauer in which they use the same intervention. And this time they looked at the core brain networks that I was talking about. So same kind of thing, they took 6th graders, 8-week mindfulness course, and they had active controls. The difference here was that they completed an attention-based task as opposed to like an emotion, like seeing fearful faces. And they found that relative to controls, the children in this intervention group had preserved attention. And additionally, they found that the core brain networks weren't as disrupted. So I talked about that there's a negative correlation between the network that focuses more internally versus the one that focuses externally. And so they were able to preserve that functioning in their brain. So over the past few slides, the big takeaway that I think you should have is that mindfulness and meditation appear to employ unique neural mechanisms that could be more conducive to a child with a developing brain. And then I would also like to talk about how there's significant overlap with children who receive a cancer diagnosis and traumatic experiences when we look at the effects on the brain. So here they talk about several structural and functional alterations that are similar between children with post-traumatic stress symptoms and children who with cancer. So this included both with active cancer and survivors. The effects are listed on the slide, so I won't read each one of them, but I think the big thing I'd like you to take away is that in literature, there's a consistent, back and forth as whether cancer itself is a traumatic experience. And so putting that aside, there's still evidence that it causes structural and functional changes that may kind of increase the vulnerability to the development of mental disorders that we see. And so that kind of goes to our preliminary study. So in this one, we looked at the effects of meditation on brain activity in a sample of children. So this was, those with previous diagnosis of cancer or survivors. They went through a 4-hour based meditation program. so that we could ensure some baseline knowledge. And we told kiddos to engage in either 2 meditation conditions, focused attention to breath or mindful acceptance, a non-meditation emotion regulation technique. So this was distraction. So we told them to count, backwards from 10 in their head, and then a passive viewing technique in which we just told them to watch the video clip. After that instruction, they were shown the video clip with distress-inducing stimuli. So we wanted to include relevant stressors. So we included a child receiving an injection, and then they rated the distress using a modified DASA scale. We got a brief break, and then we repeated the trials. We found a few things here. One was that compared to the control condition, meditation, the meditation emotion regulation technique was associated with lower activity in the default mode network. The non-meditative technique distraction didn't show that similar reduction in the default mode network. And then compared to distraction, meditation-based emotion regulations had lower default mode network activity. And what's interesting is that we didn't actually see differences in the distress ratings between the conditions. But the main takeaway here is that there may be a role for meditation-based intervention in modulating neural activity, so that especially in youth, that are experiencing a disproportionately higher level of stress, we might be seeing effects before the physical manifestations of the disease in their brain. But again, this was more of a pilot study. That's a hypothesis that will lead to longitudinal studies with more participants to explore that idea. And then the final portion of the talk, we'll be going over future avenues and some cool research and potentially use in a clinical setting. So one of the things that it might be worth exploring, are there different effects of different meditation on the brain? This was a study in adults, and they took 78 fMRI studies, and they found that, they broke it up into 4 meditation categories, and they found that there were distinct differences in activation and deactivation of various brain regions. I won't go into the specifics, but I think it would be cool to see if we see similar effects in children. And then there's some cool research that's coming out. Actually, this was from the School of Medicine, but they're looking at the use of virtual reality meditation-based interventions in opioid use disorder. Very briefly, they took patients that were undergoing methadone maintenance treatment. They completed a 12-week intervention, and they were, worked with a therapist that assisted with virtual reality assisted breathing and meditative techniques. They found several interesting things. One was there was a reduction in pain, opioid cravings, in anxiety, in depressive symptoms. And then they also found a reduction in the salivary cortisol, so one of the markers of anxiety. It's not so much a reduction in other measures such as CRP. And then they also found changes at the level of the brain. So they focused on specific areas of the brain that light up when an individual experiences physical pain. And so after the intervention, they found reduction in one of those areas. And they also looked at something called pain functional interference, which, similar to how it sounds, looks at the extent to which pain will hinder your engagement with different parts of your life, such as recreational activities, cognitive, emotional activities. And so what they found were individuals who had a high level of this functional interference also had an increased activation of that brain region that is associated with physical pain. And then, it's estimated that substance use disorder occurs before the age of 18 in about 15.2% of individuals. And it's obviously concerning. And so there was this meta-analysis that looked at the effect of these different interventions on substance use disorder. Overall, there was a large effect on reducing levels of stress, a significant medium effect on reducing cravings, and a significant small effect on reducing severity. And there was also a finding with tobacco smoking. And I think it would be interesting to see if we see similar benefits in a pediatric population. There's also, we can talk about the role of mindfulness and trauma, touch on it briefly earlier, but in this one, they included, I want to say like 60-ish studies in their systematic review, 24 in the meta-analysis. And they actually looked at several mind-body interventions. They looked at, mindfulness-based interventions, but also exercise and yoga. And they found that there weren't really differences in effectiveness between the mind-body interventions, they all, generally had moderate to large effects on improving various trauma outcomes. So things like depression, PTSD scales, impulsivity, intrusive thoughts. And it also, the other cool thing from the study was that there weren't significant differences in effectiveness based on the type of traumatic experience. So that kind of speaks to the potential generalizability of these interventions. And then there's cool research coming out about like using real-time neurofeedback. So that there was this pilot kind of like proof of concept study. They took 9 adolescents who had a lifetime history of depression or anxiety. They went through an initial fMRI to help map out their brain. And then they went through a brief like mindfulness-based training. They went back into the scanner and were given instructions. So what they saw were like, you need to move the white dot on the screen to the red circle. And what that white dot going in the red circle represented was lower activity of the default mode network, lower activity of the default mode network compared to the central executive network. So preserving that kind of negative correlation or anti-correlation we talked about. Again, this is a very like initial preliminary study, but there were some promising findings in that like every participant was able to move that dot to that red circle. There was also the fact that this was after one session was promising. So I'm curious to see what this looks like with multiple sessions, more participants, and maybe different imaging modalities. And then there's the role in autism spectrum disorder. So briefly, this meta-analysis, I think the unique thing about this one is that they also included caregivers, and in all 3 groups, what they were looking mainly at was different measures of subjective well-being, which included like positive and negative affect scales, in addition to like evaluations of overall life satisfaction. And what they found were both short-term benefits in subjective well-being that were maintained at 3-month marks for all participants, regardless of the group that they were in. And then there's a role for mindfulness in eating disorders that I think needs to be further explored. So, with eating disorders, they have a median age of onset of 15.5 years, and in nearly half of the individuals that'll occur before the age of 18. And so this meta-analysis included both clinical samples and randomized control trials with non-clinical samples. And what they found was mindfulness was inversely or negatively correlated with various psychopathology related to eating disorders. So specifically, they found a strong negative correlation with body dissatisfaction, binge eating, emotional external eating, yeah, that's the big thing here, is that this was found in both clinical and non-clinical samples. And so I think the big takeaway here is that there seems to be a promising role of meditation-based interventions and various pathologies that are relevant in pediatric population. But there's definitely like a lot more work to be done in determining the true efficacy and making sure that we're using rigorous techniques to look at the effectiveness of these interventions. And there's a lot of work to be done to figure out, specifically in children, what are these underlying, neural and physiological mechanisms that could explain these benefits. And then, yeah, that's, thank you to everyone for attending this talk. A huge shout out to my mentor, Dr. Mursak, everyone at the Department of Psychiatry and Behavioral Neurosciences. And if anyone's interested in learning more, we have a podcast about looks at neuroscience and different brain disorders called Brainstem, and we'll cover topics like PTSD, effects of air pollution on the brain. And then we also I also listed lab website and my email in case there's you want to learn more about our projects or you want to reach out to me with any questions. And with that, I would be happy to take any questions. And if you don't want to ask a question, feel free to share your own thoughts or experiences. That'd be totally fine as well.
Thank you very much, Aneesh. This was amazing and very informative. Are there any questions from our audience?
Hi, good morning. This is Laura Benjamins. Thank you so much for that amazing talk. Very impressive. You did a really great job, so thank you. As Jen mentioned earlier, I'm an adolescent medicine doctor. I'm a huge advocate of teaching mindfulness and meditation practices to the teens that I see. But my challenge is I feel like it's really hard to get them to engage and kind of commit to those practices. So any suggestions about brief interventions we could do during the clinic visit or other ways to kind of get them engaged?
Yeah, that's one of the biggest challenges with you know, when you're dealing with children, when you're dealing with adolescents. I would probably have to look into, you know, some of the more proven ways that, you know, would engage adolescents, but some things that like come to mind. What I've seen, and this is completely anecdotal, this isn't backed by studies, but finding ways to, you know, engage, whether it's use of different technologies and incorporating that in mindfulness. So when I was on my pediatric rotation, a popular, you know, application I heard about was Headspace. That's just one of many. So finding ways to maybe incorporate that, you know, something that an adolescent will use regularly in their schedule, incorporate mindfulness in there might be helpful. And then also, like, you know, it helps when you have buy-in from peers around them. So if you can talk about, oh, like, you know, I have several other adolescent patients that have, you know, had benefits of this. There's sometimes I feel like that aspect could help if they feel like their friends around them are also engaging with this. But you're right, it's definitely a challenge. And, you know, I could, even if I did look into the literature, I could go over so many things of, oh, like this might help, but it's always different in clinical practice.
Yeah, I've even contemplated, like I do often recommend different apps and different workbooks. But I've even contemplated like even just trying a 3-minute meditation while they're there with us, just to, you know, introduce them to it. But it's really challenging. I think it has so many benefits. It'd be great if there'd be more, you know, if schools were teaching it on a regular basis, or
Right.
you know, that it was more of a widespread practice, like you said, so that their peers were doing it, other people were doing it.
Yeah, and like you know, you have 3 minutes out of, you know, a however long minute appointment in which you also have to address, you know, their physical health needs. So, you know, that obviously has its place, but if you know, I feel like I agree in that, like, it would be a lot more helpful if they had something like in a school setting in which they're getting exposed to a couple times a week over the course of the year. I feel like that's maybe a way that we could you know, improve use of mindfulness-based practices in adolescence.
Well, thank you so much. I really appreciate it.
Appreciate that. Thank you.
Hi, my name is Dr. Buck Saxon. I'm a pediatric endocrinologist. So, of course, I'm very intrigued about the use of these techniques with children with diabetes. But one of my questions is, I think it would be more powerful to introduce it at the onset of diagnosis of diabetes, because we do a lot of education. But I don't know that we include education about, you know, managing your chronic illness. And so I think it would be very interesting to see incorporating some of these techniques, mindfulness, at the onset of diagnosis, so that, you know, the child grows up and learning how to utilize this as a tool for managing a lifelong disease.
Yeah, absolutely. That's a great point. Off the top of my head, I can't think of any studies that have actually looked into that, specifically in like a diabetic pediatric population. So I think that would be a cool avenue to explore. And I also think it's very relevant, you know, during my pediatric clerkship, or even when I, you know, in internal medicine clerkship, it was always heartbreaking to see cases where, you know, you had children with a diagnosis of type 1 diabetes. They didn't receive adequate education, or you know, for various external factors, you know, familial life, social stressors, they haven't been able to stay on top of their disease management. And so you have these repeated admissions for DKA. So I think that's a great point that you brought up, and hopefully that would help in improving the trajectory of their disease. Thank you for your question.
Dr. Parker?
Dr. Robbie?
Oh, sorry.
Oh, go ahead. Yep.
Thank you. Excellent presentation. This is going to be a slightly paradoxical question. people of my age that have used meditation techniques to help cope with stressful situations, I will notice that I don't even think about it. My breathing changes. So I guess what I want to ask you, Aneesh, is how important is the intentionality to these mindfulness techniques?
Yeah, that's a great question. I think so. One of the first things that comes to mind is that there's, I can send you some studies too, but there have been studies done in like long-term meditators to see, all right, what are some changes at the brain level in someone who's done meditation for a while and not as much thinking about it versus meditation naive individuals. Off the top of my head, I wouldn't be able to tell you the exact findings that they had, but there are significant changes at the level of the brain. So I think, based off reading that, intentionality probably matters more at the initial onset. So like specifically in children, when they're just starting out with meditation, as opposed to when they've been doing it for several months, several years. And, in one of the studies I brought up that looked at the effects of a mindfulness-based or meditation-based intervention in school setting, what they found was children who had a greater increase in mindfulness had a significant reduction in the their problem behaviors and the stress that they experience over school. So there is that evidence that children who have maybe more buy-in or that are more intentional about these practices and as a result are receiving more benefit from them will more likely to see those benefits in their personal life and their emotional and their social functioning. So I think to answer your question, intentionality probably matters more at the onset as opposed to when you've been doing it for a while. Thank you for your question.
I don't know if we have time. That was very nice. Aneesh, I don't think our paths have crossed. But my question is, we have a lot of children now surviving. About 80% of children with cancer survive. I'm just wondering if you have extended your studies or you have plans of extending how these interventions are helping them become adults and survive in the real world life, and how this is, are they continuing what you have taught them, and how it is helping?
Yeah, no, that's a very good question, and you're right. That's kind of the basis for a lot of our research. Is we're seeing all these amazing improvements to individuals or children who can survive childhood cancer. What are the long-term effects on their mental well-being? To my knowledge, there haven't been any like longitudinal studies that look at the impact of using these interventions early on in terms of whether it improves their outcomes as an adult or whether they're more likely to stick with it. But again, that's something I'd be interested in looking into, and I think that's a very promising future avenue of research too.
So, by the way, I've known Rabbi Goldberg for many, many years. So if you see him, give him my best.
Absolutely, will do. Thank you for your question.
Well, we are at time, everybody. Thank you so much. Thank you so much again, Aneesh, for your very interesting and informative talk. I think we all can take away a lot of information from here, and I think we're all kind of motivated to use some of these techniques with or at least explore using some of these techniques with our patients. Thank you, everybody. I think Jen has already placed the link for your CME credit in the email that was sent out yesterday. Have a great day. Thank you.
Thank you, everyone. Thanks, Dr. Smithman.